You are watching GDTV's special report on natural healing discoveries. Thanks for joining us for another episode of Natural Healing Discoveries. We feature the top doctors and healers around the world. In this episode, Dr. Stephen Rosenblatt, one of the few earliest Americans who received his acupuncture license, will share his insights on how to integrate alternative medicine into the traditional Western medicine. Dr. Rosenblatt completed his medical school training in England and went on to do a family practice residency at Kaiser Hospital in Riverside, California. Dr. Rosenblatt was also the founding director of the University of California, UCLA's Acupuncture Research Center in the medical school's Department of Anesthesiology. This was the first acupuncture clinic in a medical school in the U.S. He is the author of many published research articles, and his best-selling book, The Starch Blocker Diet, was published by HarperCollins. His most recent book has been published by Balboa Press entitled The Birth of Acupuncture in America, The White Crane's Gift, with a co-author, Keith Kurtz. It is available in all major bookstores and on Amazon. Dr. Rosenblatt will offer classes at Global Masterclass. You can find more information and take classes from Dr. Rosenblatt and many other world's top doctors and healers at www.globalmasterclass.org.
Welcome to our show, Dr. Rosenblatt. How are you?
Thank you so much for having me. It's a pleasure to be here, all the way in Los Angeles.
Well, absolutely. I have interviewed so many natural healers and also acupuncture doctors around the world, but I'm truly looking forward to this interview. And because you are one of the earliest American acupuncturists being trained in Asia, you also organized and was the first clinical director of the Acupuncture Research Project in the UCLA Medical School. And also, I remember reading your bio and your license, acupuncture license. The number is number 8. Is that correct?
That's correct. That is correct. I was the first Westerner licensed in the United States. So I was very early involved in it. It was one of these things that just kind of happened to me. I didn't really seek it out. It kind of seeked me out. I met an old Chinese man while I was doing Tai Chi. I had studied Tai Chi for a number of years and was practicing in the park. And an old Chinese man came up to me and started to talk to me. He had never seen a Westerner at that time doing Tai Chi. And he liked me and invited me to his house for tea. And we started talking. And I was a graduate student at that time at UCLA studying brain chemistry. And I was studying how brain chemistry influences pain control. And he just said to me, well, let me show you another way of controlling pain. And it turned out he was a very well-known, internationally well-known acupuncturist.
Interesting.
So that's how I got involved.
So that was quite a career decision, considering you were studying medicine and the Western medicine. So
right.
Is there any other reason make you decide to start learning Chinese medicine and acupuncture?
Well, I had somewhat of a basis in studying Tai Chi. And so I was very interested in energy and the flow of Qi and how it could be utilized. And so when he came to me, he said, let me show you some new ways of healing. And they were completely revolutionary from my point of view. Being a Western trained, highly Western trained, a PhD from UCLA. And it was a completely new revelation. It just opened up a new world for me. And so he took me on as his student. He said, you're my Lofan son. You're my son, not Chinese son. So he taught me.
You're very fortunate, to have that personal relationship. But let's talk about medicine. And you have a Western medicine background. Like you also have an MD degree. So from the Western medicine standpoint, what is acupuncture and how does it work?
Well, even from a Western point of view, we understand that there's electricity in the body. I mean, we measure from a Western point of view, we measure EKGs and we measure EEGs and we measure EM, all these electrical measures. We use this regularly. This is a very standard approach in Western medicine. What acupuncture presents is a way of looking at a total electric field, not just small electrical events like an EEG or something, but a total electrical field that surrounds the body. And this bioelectric field is called qi. It's nothing different than we would expect by measuring electrical potentials in the body. Now, it's not exactly the same as the electricity that we measure coming out of the wall socket. It's a bioelectric field. So it works on biological phenomena. And this electric field, this bioelectric field, controls the functioning of the body. And Chinese medicine realized this centuries ago, that we're really controlled by this electrical phenomenon, this electrical field that controls all the tissue organization. You know, if I tell my patients, you know, how we're organized in a certain way, how does the liver cells know to grow in the liver, and they don't grow on your elbow. And the idea is that the body is organized by these electrical fields that attract certain physiological parts and biochemical parts to the correct areas. So there's certain patterns of electricity that organize the body and organize the tissues. And this was a phenomenal revelation that there was a total electric field. So the idea of electricity is not new in Western medicine. It's been there for years and years. The idea that there's an organization that can be manipulated, that can be utilized to cure disease and prevent disease, that is a new idea.
Can Chinese medicine and acupuncture treat those chronic conditions effectively in your experience?
Well, that's a great question. I start from the point of view that the highest calling of a doctor is to prevent disease. So really the main focus of acupuncture in Chinese medicine is going to be preventing these problems in the first place. You know, my teacher taught me an old Chinese saying, and this old Chinese saying was that only the inferior doctor has to treat the disease he was not effective enough to be able to prevent. So prevention being the highest key. Now,
absolutely right. This country, our medical system is not based on prevention.
Correct.
You're not taught in the at the medical school to prevent certain diseases and medical conditions. You're taught
yes, it's true.
Surgeries.
This is the revolution. This is the revolution going on right now. This is where Chinese medicine, where Oriental medicine fits in, and acupuncture fits in to prevent these types of problems. Not that it can't be used afterwards, after the problem presents itself, but its highest calling, its greatest utilization is really going to be in preventing these problems and keeping people healthy. That's really where we're going. That's where the savings, if we're talking about monetary savings, comes in if we prevent these problems from getting hold.
Yeah, so what are the common or chronic conditions that acupuncture and Chinese medicine can treat effectively?
Well, the first and most common type of problem is pain conditions. So acupuncture is wonderful at treating pain. It also can be utilized for treating stroke, post-stroke problems and paralysis. All of these things can be well utilized by using acupuncture. Additionally, it can provide assistance and support in treating many, many other conditions, heart conditions, for instance. There's a number of different conditions, high blood pressure. The diabetes can help be controlled. Now, it doesn't substitute sometimes for medication, but it works with medications and with herbs and with supplements in order to help these conditions. And it can be very, very useful and will continue to be useful going forward.
Right now, this country and whole world were facing the challenge of the COVID-19. So in your clinical experience and also research, can Chinese medicine treat COVID or relieve some of the symptoms?
Well, first of all, the most important aspect is going to be strengthening the immune system. Just as we talked about prevention, part of prevention is going to not only be treating disease, but actually helping it before it becomes settled into the body by strengthening the immune system. For instance, we're now talking about vaccinations. Vaccinations are just one way of strengthening the immune system. That's what it does. A vaccine doesn't kill the virus. Acupuncture doesn't kill the virus. I sort of joke with my patients, the needle doesn't stick itself into the virus and kill it. But what the needle does is it stimulates the body's own innate energy system, its chi, its flow of energy, to act as a shield, to prevent the virus from invading and multiplying in the body. So strengthening the immune system is going to be a key issue. And that's where acupuncture, herbs, supplements, qigong, all of these things can be useful in building a defense mechanism. And that's really going to be the key.
Yes, so you have training from both East and Western medicine. So in your perspective, what are the major differences between the two medical systems?
Well, everything is a hierarchy. Everything is higher and lower. The highest and the finest is energy medicine. And that's where Chinese acupuncture, even herbs, work on energy medicine. They work on the controlling the function of energy flow in the body. Now, the body is also made up of tissue. Tissue medicine is where Western medicine comes in. It's very advanced in surgery and does a tremendous job when something has to be removed or has to be surgically corrected. So the highest calling, the highest level is going to be energy medicine and controlling the flow of qi in the body. Once that is out of control and allowed to go on and produces disease, sometimes surgery is necessary. That's where Western medicine is going to be useful. But it's further down the priority list, if you will. I always see surgery as the last possibility, the last alternative. After everything else has been exhausted, then sometimes surgery is necessary. Western medicine's good at it. Eastern medicine, Chinese medicine, acupuncture, they're better at prevention. They're better at treating in early stages before the disease becomes implanted in the body. So they work hand in hand. They work together. They're both necessary.
Well, indeed, especially with all the major medical breakthroughs in this decade, gene therapy, and Western medicine has definitely advanced in so many fields. So how can century-old Chinese medicine and also Western medicine be integrated into our health system to treat especially those chronic conditions effectively and cost effectively?
Yes. And, it's going to be a process. I don't have a particular formula right now, but we see the process is already happening. When I first started to study, there was no licensing, right? Everything that was done was without a license. Now, almost every state, I believe we're up to 48 or 49 states license acupuncture. So Chinese medicine, which a very few years ago, back when I started, since I was the first one licensed, that there wasn't any licensing. Within a few years, every state has licensed acupuncture now.
Right. In that regard, forgive me to interrupt you. I think all the acupuncturists should be grateful to you because you were one of the pioneers and actually promoters of making acupuncture as part of the major medical system and to be, of course, reimbursable by the insurance and to be recognized by medical political system as one of the healing modalities. So all the medical healers and acupuncturists should be grateful to you, to your work.
Well, we're all working together. Everyone works in their own way and everyone has a different part I often say it takes a village. You know, it takes many people working together to achieve anything. So yes, I was very early involved. I set up the original schools. I set up the clinic at UCLA, which was the first clinic in a medical school. You know, even if you allow me to just show a copy of a book that I wrote called "The Birth of Acupuncture in America," and it is a kind of a recounting of how we set up the field of acupuncture and how we set up some of the early schools and licensing programs. But now it's, you know, it's much further along the road. As I say, it's licensed. Acupuncturists work in hospitals, they work in medical clinics, they work alongside Western doctors. Many Western doctors have learned acupuncture now. So there's a melding, there's a joining together of the fields, which is really my aim. I started out as an acupuncturist, and then after 20 years, I went back to medical school. So I learned the acupuncture and Chinese medicine first, and then went back for an MD degree. So it's always possible to learn more. It's always possible to integrate more types of healing, and that's really been one of my goals. So if people are interested, again, The Birth of Acupuncture in America, a book that I wrote, is sometimes called The White Crane's Gift. The white crane is the symbol of the doctor, of course, in Chinese medicine. The doctor, the Chinese doctor, bringing the gift of Chinese medicine to America. And that's really the idea.
I think for anyone, especially the medical professionals in the acupuncture, oriental medicine, or you're just a general public, you're interested in alternative healing. And that book is a wonderful, wonderful book to give you an overview and what's the history of acupuncture and Chinese medicine in this country. And I absolutely highly recommend that book. Well, you know, during this COVID, I saw a statistic that says, on average, nationwide, we all put on about 11.5 pounds. And you have written a bestseller called the Starch Block Diet.
Yes.
So I have to ask your recommendation, and what would you give to the general public regarding weight management, considering overweight is one of the high risk factors for people to contract COVID, and also, of course, other chronic conditions?
Yes, that's a very good question. You know, one of the things that we found in our research with weight gain and weight loss was that it was carbohydrates was really the major problem. And you see now the keto diets and all these diets that cut down on carbohydrates. One of the things that we developed was the use of a product, a white bean, a natural product that prevents the breakdown of starches. So it means that the starches don't break down into sugars. And I did a lot of lecturing in China and Asia, where, of course, obesity is becoming more of a problem now because of a sedentary diet, a sedentary lifestyle, where people used to be working in the fields and laboring. Now everyone's in front of a computer. So the idea is that you stop this breakdown of starches, rice, bread, potatoes, pastas, into sugar by using this white bean extract. It stops the production of alpha amylase. Alpha amylase is the enzyme that cuts up the long chain starch molecule into little bits of sugars. So by stopping that breakdown of starch into sugars, you take a tremendous number of calories out of the diet. And you will find that the weight loss is much easier. Involves maybe a little bit of exercise, but cut down on the carbs, cut out the starches. Use phase 2 is the name of the product, which is, as I say, a white bean extract. It's an extract from the white kidney beans. Natural product, very nicely extracted using water-based extraction, low temperature. So it's very safe and very effective for stopping the breakdown of starch into sugars.
Well, Dr. Rosenblatt, we have to do another episode on the weight management by yourself.
Okay, well, we can do that.
So My last question. So where do you see the future of acupuncture in the U.S.? What kind of role it's going to play in our medical system?
Well, first of all, we've got to get it covered by most of the insurance companies. It's got to fit into the insurance model. And it is beginning. More and more insurance companies now are covering acupuncture. We need Medicare to start to cover. We need the Medicaid to start to cover. In other words, we need a number of the government-based insurance companies to start to cover that. And that's going to provide incentive for more practitioners to get into the field where they'll be reimbursed for their efforts, reimbursed for their treatments. I think that's happening. More hospitals have to hire acupuncturists and Chinese medicine doctors. It's starting to happen. I helped the program develop at UCLA. I helped the program develop at Cedars-Sinai Hospital in Los Angeles. A number of hospitals I've worked with to help develop these programs, and it's coming. It's coming. It's happened very rapidly. I know it seems like a long time, but given the length of medicine and the length of Chinese medicine especially, this is just a blink of an eye where we've gone from not licensed to licensed in almost every state and covered by many insurance companies and employed by many hospitals. It's been very rapid, and we're going to find out this acceptance is more and more rapid. More people want natural medicine. More people want to find ways of treating pain that don't involve painkillers or narcotics. This is a perfect match of East and West.
Well, indeed, especially when we're facing the challenge of COVID globally, and we must utilize all the wisdoms and all the knowledge we have gained over the centuries, in addition to the Western medicine, vaccine shots, and all the treatments that are currently available to combat COVID. And well, I want to thank you so much for taking time out today and to share your knowledge and also your book with us. And we're definitely looking forward to having you back for another episode on the weight management.
My pleasure, anytime. Thank you very much.
Thank you so much, Dr. Rosenblatt.
Wonderful job hosting.
Goodbye.
Thank you. Bye-bye.
You are watching Global Dragon TV's special report on natural healing discoveries, featuring top doctors and healers from around the world. If you would like to be featured on our Natural Healing Discoveries show, please contact us at globaldragontv@gmail.com. Please tune in to our next special report on natural healing discoveries on our 24-hour channel, or visit our website at www.globaldragontv.com. Are you interested in becoming the master of your own life, health, wealth, and wellness? Learn from top masters around the globe. Please visit our website at www.globalmasterclass.org.